morning everyone, it's my pleasure to welcome you all to today's session on ectopic pregnancy. We are honored to have Dr. Jyothi Kala, consultant obstetrics and gynecology with us at Manipal Hospital Sarjapur Road. Hi doctor. Now we will move to Q&A session to address some concerns that reflects common causes and to promote general awareness. The first question is, what is an ectopic pregnancy and how does it differ from normal pregnancy?
An ectopic pregnancy is a pregnancy that develops outside the cavity of the uterus, unlike a normal pregnancy that develops inside the cavity of the uterus. The most common site of the ectopic pregnancy is the fallopian tube. Now, as the fallopian tube is small and does not have much dimension to grow and accommodate this growing pregnancy, it can burst, and this can cause life-threatening internal bleeding to the mother.
The next question is, what are the early signs and symptoms of an ectopic pregnancy that an individual should be aware of?
The most common symptom of the ectopic pregnancy would be pain to the lower abdomen, which might start as one side of the lower abdomen and slowly radiate to the whole abdomen. Along with that, patient might even have bleeding, vaginal bleeding. Along with that, dizziness or fainting episodes. Sometimes the patient might not have any symptoms and might directly present to the emergency in shock caused by extensive internal bleeding.
The third question will be, what are the potential causes and risk factors for ectopic pregnancy?
Risk factors to the ectopic pregnancy can be infections like tuberculosis, which are common in India, pelvic infections like sexually transmitted diseases, any surgery that has happened on the tube, like a tubal recanalization surgery that is done post a tubal ligation or tubectomy surgery, endometriosis, smoking, these are all risk factors. Even a previous history of an ectopic pregnancy in the past increases your potential for ectopic pregnancy in the future.
And the final question will be, how is an ectopic pregnancy diagnosed and treated and why early intervention is critical?
To diagnose the ectopic pregnancy, we will first do a urine pregnancy test or a beta-HCG blood test, which confirms the presence of a pregnancy. Then a transvaginal ultrasound, which is a scan which is done through the vagina to diagnose where is the pregnancy sited. Is it inside the uterus or in the tube like an ectopic? Now, this all depends, and the treatment depends on when the patient presents to us. So here early diagnosis and treatment is very important. If this pregnancy is picked up early, before the tube bursts, then we can manage it through medications. Most common, the medication that we give is an injection methotrexate that arrests this growth of the ectopic pregnancy and dissolves the ectopic pregnancy where it is, in the tubes or elsewhere. Now, if the patient presents after the tube has unfortunately burst, then it depends on the clinical condition of the patient. If the patient is clinically stable and the internal bleeding is not much, then we can manage it with a laparoscopic surgery, which is a small surgery with small cuts that are given on the abdominal wall. This will help us access the tube and control the bleed from there and clear the internal bleeding inside. But unfortunately, if the patient presents late, when the tube has already burst with massive internal bleeding inside, then the only way is an open surgery, which involves a larger cut to the lower abdomen to remove and quickly arrest the bleeding at that time and clear all the bleed that has happened inside. That time even blood transfusion might be necessary. Hence, it is very crucial and critical for us to be able to diagnose this ectopic pregnancy early and to intervene early to prevent the life-threatening complications that the ectopic pregnancy can pose. Thank you.